evening, everybody. So now we have the Dental Hygiene Forum, and I'm delighted to introduce the panel. I'm going to start with Lisa Pearson because she's on my screen on the upper left there. Do you want to start, Lisa?
No pressure then. For anyone that doesn't know me, I'm Lisa. I am 23 or 24 years in dentistry. I did dental nursing first, and then about 17 years ago, maybe, ventured into dental hygiene. I work largely between general practice and specialist perio practice. And my goal in life now is to retire early.
Thank you very much, Lisa. I'm going to go to Kate.
Hi, I'm Kate Reading. I've been qualified now for 20 years this year. Also started off dental nursing and went into my dental hygiene. I've worked in a mix of general and NHS practices over that time. And for the last 6 years, I've been lucky enough to work in a specialist referral practice. Yeah, and I've been studying with Siobhan and Lisa in the diploma in oral and positive health.
Thanks, Kate. And Kathryn? Unmute. Kathryn, yeah? I'm going to go to Helen.
Hi Siobhan. I'm Helen Minnery. I've been qualified 32 years this year, so a long time, and I was a dental nurse before that. I work in a private practice. It's a specialist and general dental practice. I've worked there for 29 years, and I'd say I've solely worked at that practice for about 18 years.
Well, fantastic. Thanks, Helen. Kathryn will be back in a minute. I'm Siobhan Kelleher. I'm the clinical project lead of the NSK Ikigai Oral Hygiene Programme. I've been qualified as a dental hygienist for about 22 years now. I went back to study a few years ago, very passionate about dentistry, well, most days anyway. And I'm an accredited course provider, so really passionate about education and continuing our professional pathways, if you like. And on that note, the question is, so the therapy kind of ended, but I'm going to start this evening with, how has the role of the dental hygienist evolved over the years, and what do you see is our future in dental hygiene? Shall we go to Helen on that? Do you want to?
Yeah, well, being qualified 32 years, I've seen a huge change within my scope of practice. When I qualified, LA infiltrations had just come in, but working in practice, we had no really responsibility for the patient. You know, if the dentist didn't diagnose perio, you didn't do it. They weren't your responsibility. I know that now that sounds horrific, doesn't it? But the roles changed so much in 30 years. It's been a slow process, but I've seen a vast change. And if you think of the scope of practice, everything we can do. If you looked at the scope of practice originally, it was just S&P, OHI. And if you look at the size of it and the length of it now, and moving on another 10 years, you know, is that going to change even further, and what could be incorporated in that? That I don't know. I'm not sure how that is going to change, but just seeing what I've seen the change in my 32 years is vast.
Yeah, and if you even go back to when the role was created, which is over 100 years ago, the idea was really that we were meant to go out into the community, weren't we? But that didn't happen, and we went into surgery. And I suppose people didn't, like, the practices didn't really know what to do with us.
No.
So even like the same in my time, I've seen a massive difference and like great progression, really, if you like. So if we think about the dental hygienist contributing more in the general field, in a medical field, if you like, and what we can contribute. And if we look at the moment with the World Health Organization, looking to governments, the governments are looking to what they call mid-level professionals, and perhaps we might not like that term. But the Irish dental officer said that dental hygienists and therapists, we're in the right place at the right time. And that's looking at, because non-communicable disease are going to cost about 43 trillion by the year 2030. So I'm going to give this to Lisa first. How do you see our role, if we look at maybe lifestyle medicine, positive psychology, and integrating that? How do you see that working, Lisa?
Big question, Siobhan, isn't it? I don't know, my answer might be a little bit controversial because I do see chatter sometimes around our scope, what we could do, what we should be doing, things like bleaching and like where we can upskill to bring more value. But a lot of that is focused, I think, within a clinical setting. And I think if we look at the scope of what we have now and what we can do with the skills we have now and advance on them, I think that's what they're looking for, more so than what we want to take from them or what we want to add to. It's to use what we have now and how we can be more advantageous with that. So I think if you're looking at like the focus of things for chronic illness and stuff, they're trying to take it away, maybe that it's less pharmacological intervention and more that we are looking at lifestyle medicine when it comes to like each individual. So if we're looking at stress, like how can we do more with that? So like if you look at your patients, like how many in a day do you see that are on blood pressure medication? And do you know that there's a link between stress and the increase in blood pressure? Do you look at stress as a role for the immune system? Are you looking at someone overall, like their overall picture, their physical activity? You might have an interest in maybe sleep. How does sleep impact a person? Do you understand how that can mentally and physically impair their whole system? So I think it's more looking at what we have, how we can build on the strength of that, and then how we can then be out in the environment doing more of that. Like if you imagine yourself maybe in clinical lead role in smoking cessation and how that can affect the person. Like it's not just about saying to someone, oh, do you smoke? Have you thought about quitting? It's where we can bring more to that scenario. I feel anyway. I could be wrong now and people might disagree with me, but that's what I think about
what I'm hearing there is the pillars of lifestyle medicine, particularly.
Yeah,
that's
completely.
Lisa. Do you want to tell us? Yeah.
I think people think when they hear the term lifestyle medicine, it's like, oh, what is that? Like, no, could we really work with that? But we do that. We do that all the time. We speak about diet. So like one of the pillars is nutrition. So we're continuously talking to our patients about their diet. So if you imagine that you went off then and did a nutritional course, or, you grew that area, and then imagine yourself being in a position within your community that you were liaising with the public health nurses in regard to that, how the oral implications of that lead to system. Like there's so much around those pillars that we already do. It's just, I think, to broaden that. And we don't need any advancements in our current scope in order to be able to do that. It's just advancing within maybe some of the areas to give you the skill and the confidence to be able to do it.
Yeah, I agree. Kate, would you like to say some more on that?
Just really agree with Lisa. And I think, we're so lucky that we are in such a unique position. We see patients, like you say, with blood pressure and all these sorts of diabetes and general health conditions. And we're in a great position to be able to educate patients. And the point of lifestyle medicine is really about sort of helping people change their behaviours that are contributing towards these diseases. So by allowing us to educate patients in those areas, which, as Lisa said, we've got a huge amount of knowledge about, so much of that already, it's just about sort of advancing that knowledge and being confident to talk to patients about those areas. The pillars of lifestyle medicine, which, as Lisa said, is diet and nutrition, exercise, stress management, risky, not using risky substances too much, social connections that we talk about so much. I just think we're in a great position to talk about that really with everybody, and sleep, restorative sleep. We're learning so much about how important sleep is as part of our daily life.
Fact as well that the World Health Organization is calling on us at the moment, I think puts us at the forefront, and I think it's time for us to stand up and really be counted. And even like this evening, as you talk about social networking, I think these things are very important as well to come together, and that's certainly what the Ikigai webinars have been about all along.
I think,
so I'm going to get sorry.
I think sometimes there's confusion though. Do you know, like when you're asked, like, how do you think you can contribute? What do you think you can add? It does seem to be more thinking from a clinical environment of the scope of what we don't have. It's to get people to think within what they do have, and the
Yes.
advantage of that within what we have to bring, and be like, this is our strengths and we can strengthen this more, and then be in a good position. Like if you were say your special topic was menopause and you decided, okay, this is what I want to do. So then like how much skill you could obtain in order to be able to manage lichen planus and any other oral complications that come with it, like understanding that there's a dip in estrogen, so the estrogen receptors orally are affected. It's to know that we have so much already and to grow from that. And I think that's what the WHO and everybody is looking for from us. I think.
Yeah, definitely.
Sorry, I was going to say, and also many patients see us more than they see the rest.
Yeah.
It's like making every contact count, you know, so having that conversation with them, because they might not have seen a GP for 10, 15 years, but they've been seeing it regularly for every 3 months. So having conversations with those patients is only going to benefit them. And like everybody said, we've got those skills.
And I think the model of this 30-minute appointment and being a scaling machine, our bodies, you know, if you speak to anybody, and people can say in the chat, like, our bodies are hurting over it, aren't they? And at the end of the day, we need to look at the inflammation in the whole body and not just in the mouth. So my vision of the future is appointments that will coach patients on the whole body of inflammation, because if we're treating the mouth in total isolation, but we're not looking after inflammation in the rest of the body, what are we doing? And
it's a singular
one of the things
attack.
one of the things a few years ago, I was saying, what's not working? You know, you have to go on all these courses and everything, communication, but there's something systemically going on. So I think that's a lot of where our future could lie. I'm going to go on some questions that were sent in. And one of them is, what common challenges do dental hygienists or dental therapists face in their practice, and how do you overcome them? And it's from a new graduate that's having a bit of a tough time. Who would like to, do you want to go for that one, Helen?
Where do you start?
I know.
I think it's so hard. And I don't think it's any different now to years ago either, really. I think the common things that come up is appointment lengths, sort of respect from other clinicians, and that we're not just hygienists, nursing support, salary, you know, all those things are nothing new, which is a shame, because then that tells us there's a lot of practices that are not progressing and not moving forward and not seeing us in the way, you know, we are clinicians, we're there. It should be a team approach, and we're part of that team, not just the hygienist in the cupboard under the stairs. So I think the change, you know, the fact that it's not really changed much over the years, it has got better, and there are a lot of really good practices out there. But it's just, there are those that have not moved forward and have probably been like that for a long time as well. Yeah.
On that note, I always tell the story, like Martin Seligman, he was a psychotherapist. He was voted in as the president in 1986 in America, and it was the biggest vote in of the time. It's because he was really looking for change. And he said, well, we're treating all the people over here on the left with mental illness, but why don't we go and do some research over here on the happy people? And I always say in dentistry, why don't we? Because there's so much good and great work going on and people are very happy. So why are we not looking at those models and trying to bring those people that are not happy into that? And for this new graduate, I think you need to get out and network and reach out to us, and we'll support you the best way we can. And don't stay isolated, because, you know, that just ends up building up resentment. And we spoke earlier on the other channel about imposter syndrome. So just reach out to us, really, if that's okay. How do you stay up to date with the latest research and advancements in dentistry to ensure that you provide the best patient care? So we'll go to Kate on that one.
I think we're in quite a good position, really, that there's certainly so much information out there now. I mean, certainly being a member of the professional bodies, you get lots of information. You're getting the monthly journals, all the information there from the websites, the newsletters. reading lots of journals. I like to attend conferences because I just gain so much from conferences. I always find them very motivating. Webinars, I feel like there's so many options now, and it's quite allows you to sort of find what's going to fit in with your life at that current stage and how flexible you are. Like listening to podcasts when I'm maybe driving to work, or that sort of thing, trying to utilize the time as best as I can. I think we're quite lucky that we've got quite a variety of options.
And Lisa, do you want to say any more on that?
Yeah, I'd be similar to Kate. I do audiobooks as well, because at the minute it's not really an option to sit down. I have kids, so I think if they see me sitting down, it means that I'm on holidays. So it's like they're finding jobs for me. So I do love audiobooks because I can have one in my ear listening while also still pretending to listen to them sometimes.
Yeah, so
Or
like
cleaning the house
podcasts
or-
and things like that as well. is
Yeah,
it?
yeah, I do podcasts, but I do get some of the books I do listen to are, do you know Robert Sapolsky? He did a book, Why Zebras Don't Get Ulcers. It's really, really interesting. He
Oh,
did a really
yes,
interesting TED
yes.
talk as well. So him, because it's kind of
Yeah,
around
I do know
like
it, yeah.
neuroscience, and Gabor Mate. Now, he's a little bit harder
Yes.
to listen to. His voice is a bit, he'd be more like nighttime, getting you ready for slumber. But his stuff is really interesting as well, because his is around addiction and stuff. So yeah, audiobooks of that. So my podcasts are largely murder podcasts, or everybody's not murder podcasts.
The next one is, can you discuss the importance of CPD? I'm doing everything online at the moment. I hear hands-on is better. What are your opinions about that? I'm going to send that to Kathryn.
Hi, sorry. I've just joined with my phone. I think you've got to think about what circumstances you're in, really. And, it's not always feasible for all of us to sort of get out there and meet people, although I do think that is probably the best way, because I think it can be quite isolating, really, if you're not sort of getting out there and talking to different people and just keeping yourself up to date, and just that sort of we're all in it together kind of situation. And I also think there's some fantastic CPD courses out there now, hygienists and therapists doing courses, that are doing the job that delegate's doing day in, day out. And that's invaluable, because it's great going to listen to other professionals, dentists and so forth, but they're not doing what we're doing. And that, that sometimes can just be the thing that sort of spurs you on, that actually they know that you're in the same situation doing that job day in, day out. And those little tips and tricks that you get that on a webinar is quite difficult to sort of convey, really. So that's why I do think there's a place for webinars, and when you've got other commitments, fantastic. But I also think that really, if you can get out and do a couple of courses a year, that is invaluable.
Yeah, I think I've learned more in the breaks sometimes, chatting to other. You know what I mean? What do you think, Helen?
Yeah, agree. I know there's a generation gap, and the younger ones of today like sitting in front of the laptop doing a webinar. But for me, like Kathryn, I like the face-to-face. And even like Siobhan said, she learns more in the lunch breaks. But you're getting that connection with people. And that connection can lead to so much. So you might have gone for one thing, but you've come away with information for lots more. And it can be an isolating job. So it's about meeting the people as well. So it's not just about the CPD. It's everything that goes with it. So I am a face-to-face, definitely face-to-face.
And sometimes it's the analysis. I always say, like with sports analysis, we're a little bit like that when we come out of a lecture. And sometimes through the discussion, something will come up, but then you just think, oh my God, I never thought of like that before, I just don't get that from the screen unless there's a little bit of discussion at the end, Any more on that, Kate or Lisa?
Yeah, I agree.
Sorry, Kate, you go ahead.
I agree. I think there's a place for both. It's really handy sometimes to have a webinar. If you've got a busy family life, you can catch up on them. But I'm the same. I do really like the conferences or the face-to-face, not just for that, also to get to see the trades, keeping up to date with the trade, what's new, what isn't new. But one thing that I found really beneficial, and that Helen will know, is that I have gone and shadowed fellow hygienists or periodontists, and I've been sort of used them as a bit of a mentorship, and I found that really, really useful. Because it's a lonely job sometimes, and to go and just run things by somebody who's much more experienced than I found that very, very beneficial.
Good. Lisa, did you want to come in there?
No, I'm glad I let Kate go first. It was a much nicer response.
Okay, this is one nobody really wanted to answer, but how do you prioritize self-care and prevent burnout in a demanding profession like dentistry?
Look, Kathryn.
Lisa, you had some ways of getting around this, didn't you?
Yeah, I did. It's a decompression chamber. There's one in Cork. It's a bit of a drive for me, but it's worth it. No, I do. For the physical strain, I find Pilates is really good. Now, I haven't been at it for a while because I've been so immersed in college, but my body is feeling the ill effects of that. But like, it'll be grand. I'll pick it back up again in the summer, and I'll write it all then. So I'm not overly worried about it. And then during COVID, when I went back to work, we had extended my patient times. So like that, I was every half an hour. And then we extended it to maybe 45 initially, and then we pulled it back to 40. And I never pulled it back to anything less than that. But it made a huge difference. It made a huge difference to my mental well-being at the end of any given day, as well as my physical well-being. And the patients were happier. An awful lot of the feedback that came back was they didn't feel rushed into the surgery and rushed out again. Like, if a patient now rings and says they're going to be 5 minutes late, it's not the end of my world. It doesn't hit me the way it would have before, because I know I have the time. And because it used to be so hard to get appointments, like it could take months maybe. If I had someone in that needed IPT, like I didn't have the space to give it to them. It could be 4 months before there was an appointment. When I had the longer space, I was able to start the treatment. And then it might be a few weeks before they get in on a cancellation. But overall, it just worked better. And then financially, when they looked at that, it wasn't a huge financial hit, because for some of the patients, then I was able to maybe do a bit more work and then charge accordingly for it. So it's to kind of sit down and see what way you can jig it. I know it can be easy for me to say that because I've now got that position for myself that I'm no less than 40 minutes and then maybe anything up to 60 minutes. And that can take a little bit of back and forth within the team to kind of get that going. But once it's even trialed, I think a lot of places will see the benefit of that, and you will definitely see the benefit.
It's a calmer practice.
Much
I think
calmer.
there's less instruments going through the sterilization, isn't it?
Yeah, overall it's much better.
So going back to that as well, like, and the thing about burnout and recognizing, I think when you're in the surgery, like, am I okay? Am I actually okay? Because sometimes we're just not, are we? And checking, doing a body scan. And one thing that I used to do is just put a little sticker onto my computer to breathe, because you'd just be so conveyor belt that you'd forget to breathe. Do you know what I mean? And then that's when the pain starts hitting in. But I also think, like, the coaching and mentoring at the moment, and there's a lot out there. The associations are looking at that, and the BSDHD has a program there. And you can go privately, and sometimes people don't need counseling. They just want to air what's going on and find the space there. Does anybody else want to say more about that?
I would say when you first qualify, you don't think about that, but it
No.
needs to start then. Don't do it when it's too late. You probably at the minute, when you're starting out in those early years, and you don't think about yourself, but I always think now, if I look back, I go, you need to prioritize yourself first and foremost. So one, out of the surgery, so looking after your body, looking after your health. Like you said, Pilates, making sure that, you're stretching. We're very static in what we do, and if you're working 5 days a week. So really think about that. But then there's all the stuff we were just saying then, you know, in surgery as well, all the things looking after yourself. So just, you know, loops, light, posture, they're just the basics, because they go out the window because it becomes a treadmill, we become so stressed. But that's all going to impact you as well. And I'm looking at the appointment times. I've just, after 29 years, changed the appointment times at the practice. And I can't believe the difference. I was getting to the point of thinking, I can't do this anymore. And even those who had not been qualified that long that were, because there's 10 of us at the practice. And, you know, it was just becoming ridiculous. And the fact that it was so busy. And the change in me, never mind how the patient feels, is mentally and physically is so different, yeah.
The other thing is following your passion, and many of us have side hustles, if I might call them that. But, you know, is it really sustainable to be in a surgery full time and for your body to be able to work like that? I know my body said, no, I can't do that anymore, you know? And then I suppose just following my passion, I've ended up in a really nice place now. But do you think that side hustles help having your passions? And
I think the best thing I ever did was go part-time clinically. And obviously I know that that's not doable for everybody because, you know, obviously financially it can obviously have quite a big impact, but I am so much better at my job. I'm so much better with patients, and I feel so much better in myself because I'm working part-time and it's not that constant, not the same old, but I just enjoy it much more. And I didn't do it as a I'm going to go part-time because this is an issue. I did it because when I came back from having my children, I wanted to be part-time. But the knock-on effect on that has made such a difference to my working life and how much I enjoy all of it, really. I know I do other things as well, and I teach and that kind of thing, and that does help as well, because I think that it all sort of becomes quite cohesive. You're learning more because you're teaching, you're implementing that when you're in your clinical practice. So it's all becoming very fluid. But it just ignites me a little bit more that, you know, I'm learning more, and then I'm taking that to the patients, and the patients are getting the best of me, really, because I'm only working either 2 or 3 days a week clinically.
very good. So I have a big question here. Kate said it is a massive question. I would like to know the going rates for non-NHS dental work, UK experience, 10+ years, without a nurse in the London area. We don't usually get to discuss this topic with other hygienists, and there are no fixed scales, bands like other professions. Kate, I'm going to give that to you.
Thanks. Well, I mean, it's something that comes up all the time, isn't it? And it is, like I say, it's a huge question because there's such a variety of circumstances, isn't there? There's you know, the option of being employed, self-employed, percentage, hourly rates, you know, and appointment length time, and then that's just what our circumstances are. But of course, there's the circumstance of the practice. So how much is the charge for the appointment? You know, how much are we charging out at the hourly rate? How much does it cost? Where's the area that you live in? It's a huge question. And I don't have an answer other than to sort of ask around, you know, and locally, and speak to colleagues. And also, I know Kathryn mentioned how much a surgery costs to run. You know, we all sort of think about what it's actually the hourly rate is, and compared to what we're getting out of that. But then we have to think about how much it's costing to run, you know, to the business. It's a really big question.
It is a big question, and that's very important. I always ask that question, and most dental hygienists or therapists don't know how much it costs to run that practice, and it depends if it's a beautiful elaborate building, or you're in a little rural area, or, you know, even just outside London. So it's a lot to do with overheads, and I think that's where it's sitting down with the practice owner and negotiating that out, really, isn't it? Anybody else want to come in on that?
Yeah, I also think you need to factor in other things as well. You know, you might have an hourly rate or whatever the pay scale is at one practice to another. But what else are you getting out of that as well? Do you get full nursing support? Do you get your CPD paid? Do you get your GDC registration paid? You know, if you're employed, are you getting sickness pay? Do you get your equipment bought for you? And is it, you know, it's always kept up to date? So I just think you need to look at those factors as well, because one practice might pay a really high rate, but you get nothing. The other practice rate might be slightly lower, but there might be lots of other things to factor in. So I just think you need to look at that as well. So just because it's lower, there might be more benefits that would cost you, but that it's getting paid for. So I always think they need to be factored in.
And the
Lisa,
other part,
Yeah.
the other part I'll go back to as well, it's about how valued you feel as part of that team. I'd rather get paid a little bit less in somewhere where I felt really valued and appreciated than in a place where I earned lots of money but didn't feel, you know, I wasn't heard and I was just a scaling machine. So I do think there's an element of that as well, about mental health and being happy and being valued.
Definitely, definitely. There's one here about equipment. How do I get better equipment in practice when everything is old?
I have a theory on this.
Okay.
It's not a luxury item, it's a necessity. That's we see that a lot on the forum. It's not a luxury. A dentist would not do a crown prep or a fill-in with with something that's blunt, that's not working effectively. If you need something new, it shouldn't be that you have to ask and you have to fight for it, but make a case of need. My boss dies because I always come up with presentations of why we need this and what we need it for. And, so you're giving him a reason. You're not just saying you just want it. But the basics you should be given. But not only that, if the equipment's not working correctly, so, your Pearson tips or your Cavitron tips are blunt, they're going to affect the actual machine itself, which is going to wear. That's going to cost him more to replace that than actually just buy your new tips. Also, wear and tear, it's going to affect the patient because it's going to be uncomfortable because you're going to have to put more pressure on. It's also going to affect you as a clinician because it's going to affect your body. And then you might end up taking time off because you've got, musculoskeletal problems and need to go and see a physio. So not having the right equipment, the equipment that you need to do your job, has a huge impact on patient, clinician, and the practice. That's my theory anyway.
Yeah, I totally agree. Kathryn, do you want to say more on that?
Yeah, I would agree with everything that Helen said, to be fair. I think if you're going into a practice and you're looking around and you're thinking, oh my word, what's going on? And you're sort of getting a bit of pushback, I would look at the issues that are most pertinent. So going in and going, oh, I need like 16 site-specific scalers, I need a new Cavitron or a new Pearson or whatever. Think about actually what are the things that are at the forefront, and really put your case forward for those, and be realistic. Because I'm self-employed, have always bought my own hand scalers, and I did at one point buy my own Cavitron, but that was my choice, and there were workable instruments there. It's just that I felt I did a better job with these other instruments, so I decided to invest in myself, and that worked for me. And I know that's not doable for everybody, but yeah, I would look at being sensible in what you need to do your job, putting the patient first.
Lisa, anything more to say on that?
Yeah, I agree with Kathryn. I've done the same. I've bought some of my own stuff as well. Now, I'm not self-employed, but sometimes it's just, I would rather have some of my own stuff because I'm moving around from practice to practice. So it's mine and I'm minding them like babies because I spent my money on them. So I know I'm looking after the stuff, but like also for me mentally, and like, right, I know I'm going to work and I have what I need. I'm not going into work wondering, right, is that going to be an argument that day over, like, what I asked for this 6 months ago, why can't I have it? So some of it is weighing up the balance of what you really need versus what you really want, and then how much you're going to be prepared to, like Kathryn said, invest in yourself.
That goes back to self-care as well, doesn't it?
It does, Helen. Yeah, I'm all about the self-care.
Yeah.
Helen,
I've
I'm
always-
wondering about your self-care, because you said how many years you're now in this profession, and I'm looking going, like, you must have started like from Montessori school or something. You're so simple looking. It's seeming a little unfair right now.
Lots of Prosecco, as many of you'll know. No.
Like, do you bathe in it? Or?
No, that'd be a waste.
I think it is important to have your own little toolkit. I always have, even just with different products, and just to keep your life happy as well. Like, if practices aren't going to go there with everything, as you say, get the main ones and invest a little bit yourself. And I think when you look after your own kit as well, it lasts for ages, doesn't it? You know?
Yeah.
Any more to say on that, Kate?
Just agree, really. I've always bought my own instruments and my hand scalers, because then also I'm a little bit obsessive about them. So I know that when I'm off work and I send them off to get sharpened, and I know that they're all a good standards. And I've also bought my own Pearson in the past as well, just because I wanted to know that when I got to work, I had the tips that I wanted. And just because I'm a little bit of a diva, I want to know that it's there, but it's I've done it.
Yeah, absolutely. I'm going to go into some questions here because we have quite a few. So this is part one. No disrespect at all, but do you think that our association should now be working towards educating dentists and practice owners, as well in turn the public, how perio should actually be treated? It seems that there are all these courses for hygienists teaching or reminding us what we really need to be doing, but the problem is that dentist practice owners don't understand that a standard 30-minute appointment for everything just doesn't work.
I think it's probably down to us as well. You know, within the practices that we work in, or the people that we come in contact with, you know, I think it's us getting that out there, and that'll be dependent on how confident you are as well. You know, some people find that difficult, but if you look at the S3 guidelines for perio, it does talk about minimum appointment times to treat effectively. I think it says 45 minutes or something like that in the actual S3 guidelines for perio. So, you know, there is that little bit of information there. Obviously, working with NHS practices, that's a little bit more complex. But again, there's the document on the BSP website, the avoidance of doubt, on how you could implement that within the S3 within NHS. I don't work in the NHS, so, you know, I haven't for many years, but, you know, there are documents there can help and support that. But yeah, again, there's one of the issues is that they don't understand.
But should this not go back to training in the hospitals?
Yeah.
You know, it should start there. This you know, it should... The dentist and the hygienist should be working together. Often they're working the other end of the building from each other. They try to bring it together. I know the year that I trained, they brought us together, and the following year I heard they parted us again.
Well, in Liverpool, the new training in Liverpool that started, I think it's a year ago, the BDS and the therapy all start together, and they do the whole first 3 years together. Every lecture, every practical is together. So those that qualify at BDS will know exactly what dental therapy, what their scope is, what they can do, because they've done it themselves. And I think that is probably the way forward. That's the way forward, is that they do the first 3 years together.
Fantastic. So if we go back to the modern day and we wave a wand, what can we do? Like, should we look at the model that
I was going to say
something,
it might be a bit rude. I was going to say wait for the dinosaurs to die off and try and start on the younger ones. Sorry.
we can't do a Pulp Fiction and put them in a chair, but should we look at the model that they use in America, where they bring all the conferences together? So we have tried team approach conferences here in Ireland. I know they tried them in the UK as well, but I think for the team to have a day out, but all go to the same lectures, or at least come back, have a meeting, and say, this is the up-to-date evidence. Can we try implementing this into practice? Or the other thing is sitting down, having a meeting and saying, have you looked at the S3 guidelines? Were you all aware of that? And doing it, but as you say as well, sometimes people don't feel like doing that.
Yeah.
But that's, so I hope that helps a little bit. I know I wish I had a wand that we could wave, you know. Part 2, why are those people in influential positions not understanding what we actually are supposed to be doing? Everyone says, oh, you'll find the right practice that will allow you to treat patients in the way that you should be. But honestly, why should we have to find unicorn practice? We should all be doing the right thing. But it seems no one's fighting for this. I would love to know your thoughts on this. Will I start?
Yeah.
I didn't want to do it.
It is such a difficult one, isn't it? And I remember relocating to London and working in about 20 practices. I wondered why my husband hadn't proposed to me, because I would have thought that'd be the next step. And one day he said to me, how come you can't hold a job down? And I said, well, I can hold a job down, but I don't want to, because I'm holding out because I can't work in these environments. They won't change protocols. And if they weren't open to it, I had to move on. So 20, it was probably more practices than that. So I know you can't do that in every area, and it was okay to do that in London. But one of the things I think when people are looking for positions, that they just look for when positions come up, say, you know, on a forum or a text message, where I changed my thought process and I went after practice where I wanted to work. So I went in to them, asked them for a meeting, brought my CV in, said, this is what I can bring to your practice. And I went about it that way. And that's only the way that I've ever really been happy since, because it just wasn't working for me the other way. Does anybody else want to come in there?
Yeah, and
I
when
was probably the opposite, Siobhan, because I stayed a really long time in a practice because there was an awful lot of pluses and I didn't want to see the negatives. But I feel I was probably getting in my own way. I was probably even getting in the dentist's way, because I think we had a fondness for each other that didn't allow either of us then to grow the way we wanted to. And since I left that practice, I'm a completely different hygienist, but I was years and years in it. So I didn't move around because I was like, no. It's a little like, you know, that Taylor Swift song, I can fix them. No, really, I can.
Okay.
I think it was a little like that, where I was like, no, it'll eventually all go my way. And actually, it's only really when I left that change came in a better element for me. So I don't think we're ever going to be saying like to look for that unicorn practice, but sometimes there is going to be personality dynamics and things that just don't work. So it's not that practice is bad, or that principle is bad, or that you're bad. It's not that. It's just that, like in any profession, there are going to be personalities that it's maybe not always as cohesive or works as well as you would like. So then it's maybe just to pull back or change to get somewhere that you will fit in better. I always say this to people, like, don't stay long where you don't belong. And I say that because I stay too long. So I think it's sometimes people are misconstrue things that we're saying. So we're not saying, oh, just keep moving on until you find the right place. Oh, someone will eventually see it your way. But there's going to be a little bit of give and take in places. And I think it's to be able to navigate that.
Sometimes lovely practices don't know what we can bring, you know,
Yeah.
but just, sorry, Helen.
I was just about, and communicate if you're feeling like that, because they actually might not realize that. And having that meeting and that conversation, you know, to communicate, because they could be totally blindsided and think you're totally happy and everything's hunky-dory. You bring it up, obviously, if they don't do anything about it, that's a different thing, but having that conversation with them.
Yeah,
Definitely.
Siobhan's saying is you don't know what you don't know. And my saying is you've got to kiss a few frogs before you get you.
So we all have a little saying.
I agree with what everybody said. I also think one person's great job or great environment is somebody else's absolute nightmare. I think it depends as a person. I work in a practice where the principal is great. She's really on board. I've sort of had just that little conversation of just going around to each dentist and saying, please do not call it a scale and polish. You are giving the patient the impression that I or the therapy team, because I work with all the other clinicians, I work with a therapist, are going to solve that patient's problem. We are doing a hygiene assessment, and they've really have got on board. So it, like we say, it depends on what situation you're in, feeling valued, feeling like you've got a voice, and weighing the positives and the negatives. I've been in jobs where each month I think to myself, okay, are we still on the positives, because it's not been that great. And I think, like Lisa said, I've probably hung on in practice it a little bit too long. But then also we've got to think we have got lives, and sometimes the practice is near, and it pays well, and it suits us for that particular point in time. And you always learn something in a practice, even if it's like you're never going back there again.
Yeah, completely.
Yeah. Somebody's put doing postgrad courses. Will you just elaborate on that, or is it from the previous post? I'm not too sure. My practice has all the dentists scaling and doing NHS perio, and I'm not getting referred patients. How can I change this?
Is that because the dentists are getting some remuneration for it? Is it because they don't want to share the UDAs? That would be my sort of first thought, really. And are you working under the NHS? Are you working in an NHS practice that's doing private hygiene? Is a difficult one to answer, really, without knowing a little bit more detail. I would assume there's got to be some monetary value to the dentist doing perio,
Yeah.
Maybe if you want to just write a little bit more, and then, I mean, I don't think, correct me if I'm wrong, I don't think any of us are working on the NHS now. I have worked on the NHS, and I have worked under sort of every single, so I've worked under UDAs and fee per item and capitation. So yeah, it just gives a little bit more detail.
The other thing is, the email is nskikigai@gmail.com. If anybody, would prefer to send an email in there, we can contact you and chat it through if you like. How do I make sure I get a prescription from the dentist for local anaesthetic and tooth whitening when they want to do all the whitening themselves, and what to include in my record keeping?
For whitening,
if you're able to get that prescription from the dentist, you let us know.
To be fair, I write the prescription, put it on their template, and then they just, to be fair, mine do tailor it a little bit, but I do have a generic prescription. The whitening thing, I mean, I have done it in practice, but I don't do it now, just because we've got lots of dentists who do, and I'm busy doing other things. But I think if you're working off their referral, then if they want to do the whitening, then they want to do the whitening. I don't know what everybody else thinks about that.
Yeah, I mean, I started this with saying how too much focus on whitening and upskilling and putting it in our scope. I don't care about whitening. Anybody else can do it. I'm not interested in it.
Yeah, a lot of people are, though, just because the financial reward from it. So
yeah, I mean,
it's a hard one, because like Kathryn said, if the dentist wants to do it, he's going to do it, and obviously take the remuneration for that as well. It's a hard one to try and say, I want to do it, but I need a prescription for it. The other way around you could do that is if the patient's coming to see you in between the appointments, and you have that conversation about, if there's things that are you interested in whitening your teeth, or they have that conversation with you, and you start bouncing them to the dentist. So you're actually sort of giving them the business, and if it starts to get, you may have to split it and say, could we both do it? If you start selling the whitening, but obviously they're going to go to the dentist. So you put that in the patient's head that, and had the conversation, is it something that you've thought of? So you're actually selling the treatment, but then the dentist can do it. You could do it that way.
So what I'm hearing is you've discussed it with the patient. That's kind of yours. So
Yeah.
maybe that's a kind of a pre-agreement with the dentist.
Yeah.
Is that what you're saying?
Yeah,
Yeah.
it could be. Or showing
Like,
him that you can sell it as well for him. But then, you know, can we split it and, you know, do it that way?
you get like a referral fee.
Yeah.
Yeah,
Something
that's yeah. So even if the dentist still is wanting to do it,
Yeah.
that, you know, if you're sort of, you know, pushing a few patients through, are you going to sort of negotiate something where you say, well, actually, I'm pushing these patients through that probably wouldn't have had that uptake. So can I have some kind of like introduction fee or something like that?
Yeah.
Kate, are you doing whitening?
Very little, again, for the same reason, really, that the dentists mostly do it, and my diary is just so busy. I think that's something everyone else struggles with. I just don't have the availability. But I do like to do it every now and then, and I just say, you know, that I don't want to become de-skilled on it, so can I just keep doing a little bit every, you know, when it's possible, so that I can keep that skill going and my confidence with it.
What is better, an hourly rate or a percentage?
Oh God.
Goes back to the earlier on, isn't it, what we answered?
I'm employed, so I can't comment on the self-employed. So I'm employed on an hourly rate.
I do,
applied on a percentage.
I do a mix of both. I'm employed and self-employed on a percentage, but have been on an hourly rate. And I think it really boils down to your own circumstances, you know, with an hourly rate, but, you know, hopefully you've got the security then of getting that money each for the set period of time that you're at work, whereas a percentage, it is a little bit more risky if your patients aren't showing, or you get, you know, a failed appointment or last minute cancellation. So I think it really goes down to your personal circumstances, to be honest.
Definitely.
I work on percentage, and I've always worked on percentage. The first job that I ever got, because I trained in Leeds and was going back to Manchester, I just sent my CV round and ended up getting a job. And we were told sort of 30 years ago, do not work on percentage. I think because obviously there's no guaranteed income. So we sort of waltzed into this interview, and she said, oh, right, so I'll pay you 50% at the time. And I was like, oh, right, what do I do now? Because obviously I want the job. And I was just like, look, we were told not to. And she actually was that confident that she could keep me busy, that I had written into my contract of service that she would pay me for a minimum amount of patients, and that would like be a default thing. I never had to sort of call on that. It was absolutely mad busy. So
I think personally, percentage suits me because I'm just that type of personality. It kind of drives me more. Where I think when I was on an hourly fee and somebody cancelled and then somebody put them in the book, I'd be fuming and everything.
yeah.
And I'm just being honest.
Just boiled the kettle.
You know?
So
You're just so looking forward to it, and then God, you know, where when you're earning the percentage, you kind of just get on with it. It's just, you know,
it's quite funny actually, that, because I have always thought like that. I've always thought, well, because I've always worked on percentage, and I always thought, well, if the patient's not in the chair, then you're not paying me, so it's fine. But then I've since started to do a little bit of practice management, and I've sort of started to look at it slightly differently. As if the patient's not in the chair, even though you're not paying me, you've still got running costs and a cost per hour that you need to make. So I'm a little bit better now with the whole if somebody puts something in my diary, whereas before I was like you, fuming, thinking, well, why have you put that in at the last minute?
What are some good courses to improve my practical perio skills?
Oh, well, Helen's doing one soon, aren't you?
What do you want, Helen?
I think it's full. There's a waiting list.
Oh, Porsche, no, right, not Helen's then. Oh,
No, we've got 2 more dates for next year, but I think there are still places, but there's not many left for next year.
Okay. There is a powered proficiency that covers quite a lot in North London. So you can find out about that on the MyNSK. There's also the implant perio which Kathryn and Jenny are running if you want to know about implants. And then a really fantastic one is Prof. Nabali and Varka Ratu on September the 28th. Like, that is cutting edge research. Going to be working on like pig's jaws. You don't have to, if you don't want, you can work on models, but absolutely fantastic course, September the 28th in the Shotlander. So that's North London again. I think it's North London. What else is around?
Ross is doing one, is she? I think.
Swallow, yeah, Swallow one.
Swallow, they're doing one.
Yeah. Oh,
Julie Bassett, okay.
and BSP, haven't they got one on the Minst? They've already done one. I think there's another one. I think that's
Yeah, that's
September. I think they're booked out though.
yeah, that's the problem.
But they are doing that one on September the 28th. So that, I think there's only a few places left on that as well. But honestly, that's just a one of a kind as well, really, that day. So how long is the NSK discount for? So we give a discount code sporadically on the webinars, and everybody's asking for it this evening. So the answer is yes, discount for everybody in the audience. So what I'll do, I'll put that on in a minute, or we can send it to you anyway. Which are the good companies to invite for lunch and learn?
We had a really good lunch and learn today. Smile Line, and oh my God, the food was amazing. It was like we all got back to work this afternoon and thought we actually need to go to have a lie down. It was absolutely gorgeous. It was like a graze mat type thing. Well, it was sandwiches, but it was beautiful. And to be fair, their actual lunch and learn was very good as well.
So what did they teach you on that then?
So they were showing us that they've sort of done some new models, so for patients to show patients, and they've done models where they've actually, it's actually a case. So they've got the before in a model, the after in a model. They've made the aligner which they've given they put on to the model, and they've also given you a model that has the fixed retainer. So it's to sort of basically show the patient the whole journey in a sense, and especially from my point of view, so sort of where you need to clean, why it's so important to sort of really be excellent with your OH, and obviously increasing the surface area, because there's obviously you've got the aligner bumps on, and so it's actually really good as a sort of a resource for us, because you can really see why it would be a little bit more difficult for the patient.
Very good. Anybody know any other ones?
I don't know.
Like Ireland, I just do the ones with the reps, like Willie Dell from TP and
TP do lunch and learns.
yeah, Sensodyne do lunch and learns.
Oh yes.
I don't know, do Oral-B. Oral-B are very good, but I don't know if they do lunch and learns.
Yeah, they did.
Oh, do you know who else does Parmex with the kin products?
Oh yes, yeah.
Maybe what we'll do, if you're on the Facebook group, we can put a list of them on there. Maybe just have an ask around and do that. Do you recommend NSK diamond tips and why and how to use? So we've got loads of tips on the NSK, and I think to go into it now with just a few minutes, would you reach out to me at NSK? I'll put the email in here, and I'm happy to come on a Zoom and go through those with you. Just NSK. And we can just run through the different ones because there are quite a few. Would that help? They've just got an anonymous attendee asking that. So I've put the email there. Can somebody let me know that they've got it? Yeah. Are there any refresher courses for hygienists returning from a career break and starting up NHS work?
I mean, I'm sure, like we were talking about all the hands-on that's out there, they do get booked up. I don't know particularly NHS for hygiene. I know there's therapy.
Are they not doing Action not doing Healthy Gums Do Matter? Are they not doing a full course somewhere?
I think you're right, Kathryn, they are, aren't they?
So maybe that might be a good one if you're going into NHS, because obviously Healthy Gums Do Matter is designed for.
Yeah.
So yeah, could be that.
Got 1 minute left.
Use it wisely.
Prosecco time, Prosecco time. Thank you. Everybody stayed on. So this is something new that we're trialing to see, because when we do our webinars, everybody stays on at the end and there's lots of questions and answers. And we actually left a half an hour this evening and it's just worked out nicely. Would you like more of this? If you would you please let us know? And we're more than happy to do more of this kind of thing. Or what else would you like from us? What kind of courses? I'm putting together the webinars for autumn. And it's what you want, because you're the people that turn up here every week and we're very grateful. And while you do, we'll continue. So please reach out to us. Lisa Pearson, thank you very much. Kate Reading, thank you very much. Helen Minnery, Kathryn Mayo, thank you so much. Absolutely fantastic evening. Thank you for giving up your time.